welcome back to Last Breath Diaries. And thank you for returning for part 2 of our story, The Woman Who Faded Away. In part 1, we met Rachel Porter, a 34-year-old mother, wife, and school counselor whose life fell apart as her health quietly slipped away. For almost a year, every doctor she saw told her the same thing: you're fine. But she wasn't. She was dying, slowly, silently, from a disease so rare most physicians never see a single case in their lifetime. That disease was Addison's disease, a total failure of her adrenal glands, the small, powerful organs that keep the body balanced during stress. When they stop working, the body itself begins to break down. Tonight, we continue her story, a fight not only for her health, but for her identity, her faith, and her will to live. After nearly 12 months of fear and confusion, the diagnosis brought a strange kind of peace. At least now she had a name for the monster eating her alive. Addison's disease. It sounded harmless enough, ordinary even. But in truth, it was a ticking time bomb. Rachel's treatment began with daily doses of hydrocortisone, a synthetic version of cortisol, the hormone her body could no longer make. She kept them in a small orange bottle in her purse, her bathroom drawer, her desk at work. 3 pills a day, at the same times, every day. Miss one and she could die. Dr. Elijah Warren had warned her, "This isn't just a prescription, Rachel. This is your life support." She listened, and she believed him. But Addison's doesn't follow the rules. It doesn't care how faithful you are with your medication. Stress, illness, trauma, even a stomach bug can push the body into crisis. Rachel would soon learn that lesson the hard way. In early March of 2017, she collapsed while making lunch for her kids. Her hands trembled, her vision narrowed into a tunnel of light. Then her body gave out, as if someone had flipped a switch. Mark found her moments later on the kitchen floor, her breathing shallow, her skin cold and gray. "Rachel, Rach, stay with me." Her lips moved, but no sound came out. By the time the paramedics arrived, her blood pressure was 42/18, barely a pulse. They raced her to the ER, sirens screaming through the Portland rain. Dr. Warren was already waiting when they arrived. "Get IV access, wide open fluids, hydrocortisone bolus, now," he ordered. Rachel's body had gone into full adrenal crisis, a catastrophic shutdown caused by her body's inability to produce stress hormones. For the next 20 minutes, her life hung in the balance. The monitors screamed, her heart rate dropped. A nurse called out, "We're losing her." And then, silence. When Rachel woke, hours later, the world was dim. The lights hummed softly above her. Mark was asleep in the chair beside her, his hand wrapped around hers. Dr. Warren stood quietly at the end of her bed. "You scared us today," he said gently. "You were in crisis. If you'd gotten here 30 minutes later, we wouldn't be having this conversation." Rachel stared at him, eyes glassy. "I thought the medicine was supposed to stop this." "It helps," he said, "but Addison's is unpredictable. Your body can't adapt to stress like it used to. Even a cold, an argument, or dehydration can trigger another episode." He paused before continuing. "You'll need to learn how to live differently now. You'll have to become your own advocate, every day for the rest of your life." "Hey, Nurse Chad, did you know that Addison's disease is so rare that it affects only about 1 in 100,000 people worldwide? The adrenal glands sit right above your kidneys, and they produce hormones like cortisol and aldosterone, the chemicals that regulate blood pressure, metabolism, and response to stress. When they fail, your body can't handle even minor illnesses or injuries. That's why Addisonian crises like the one Rachel had are medical emergencies. Without IV steroids, patients can die within hours." Rachel spent 5 days in the hospital recovering. Every breath felt like effort. Every hour felt borrowed. Mark refused to leave her side. He brought her water, brushed her hair, and tried to hide his fear. But Rachel could see it, in the way he looked at her, as if afraid she'd disappear again. When she was finally discharged, Dr. Warren gave her a packet the size of a textbook. Inside, emergency protocols, symptom charts, injection instructions, and an order to wear a medical alert bracelet at all times. She fastened the silver band around her wrist. It read, open quote, "Addison's disease. Steroids required. In case of emergency, inject immediately." Close quote. The words looked cold, permanent. That night, she sat at her kitchen table staring at the bracelet. "I'm 34, she whispered, "and I already have a death sentence." Mark reached for her hand. No, baby, you have a diagnosis. That's different. Over the next few weeks, Rachel tried to find a rhythm again. She returned to work, easing into her old life. Or at least the pieces of it she could still manage. Her coworkers were careful with her now, watching her closely, speaking softly as if she might break. One afternoon, she fainted in the teacher's lounge. Her friend Melissa caught her before she hit the floor. "Rachel, oh my God, are you okay?" Rachel came to gasping, her skin drenched in sweat. "I just need salt," she whispered. Dr. Warren later explained it. Her body was losing sodium too quickly, another cruel trick of Addison's. Without aldosterone, her kidneys couldn't retain salt, which meant constant dizziness, dehydration, and cravings that never went away. Hey, Nurse Chat, did you know that Addison's disease often causes unusual cravings for salt? That's because the body loses sodium at a dangerous rate. Some patients even carry salt packets with them, eating them straight just to keep their blood pressure from crashing. In May 2017, 2 months after her first crisis, it happened again. She was at home, making breakfast for her children. The smell of pancakes filled the kitchen. Laughter echoed from the hallway, and then the world tilted. Her heart raced. Her vision blurred. She couldn't breathe. Mark rushed to her side as she fell to her knees, fumbling for her emergency kit. Her hands shook violently as she tore open the case and drew the syringe. "Rachel, talk to me," she could barely whisper. "Not again." The needle plunged into her thigh. A burning heat crawled up her body as the steroid flooded her veins. Her heart steadied, her vision cleared. This time, she lived. But the terror stayed. That night, she sat in the dark, staring at the ceiling. "I'm not safe anywhere," she said softly. "Not even in my own home." By that summer, Rachel's life revolved around routines. Pills, fluids, salt, rest. Every day was carefully calculated. She tracked her symptoms in color-coded journals. Pink for fatigue, blue for nausea, red for days she felt close to collapse. She became her own nurse, pharmacist, and patient, all at once. And through it all, Dr. Warren never stopped checking in. He called weekly, sometimes just to say, "How are you holding up?" Rachel's answer was always the same. "I'm alive," but alive felt different now. Hey, Nurse Chat, here's something to remember. For patients with Addison's, stress dose steroids are life-saving. That means anytime they face trauma, infection, or surgery, they must increase their steroid dose to mimic what healthy adrenal glands would normally do under stress. Without it, they can fall into crisis in minutes. By December 2017, Rachel's strength had slowly returned. She began to share her journey online, documenting her daily life with Addison's, the near-death moments, the misdiagnosis, the pain of being unheard. Her words were raw, honest, and human. Open quote, "If you're sick and no one believes you, don't stop talking. Don't stop searching. You know your body better than anyone else." Close quote. Her story spread across social media. People from all over the world wrote to her, women, men, teenagers, all living with invisible illnesses, all begging for someone to understand. For the first time since her diagnosis, Rachel didn't feel alone. But her body had other plans. In January 2018, new symptoms appeared. Her joints ached, her muscles burned, and bruises appeared without reason. Her energy, the little she'd rebuilt, started to crumble again. When she saw Dr. Warren for her routine checkup, his brow furrowed as he read her labs. "Your inflammation markers are high," he murmured, "and your blood sodium levels are dropping again." She frowned. "Is the Addison's getting worse?" He hesitated. "Maybe, but I think there's something else going on." Her heart sank. "Something else?" He nodded. "Your immune system's reacting to something. Something new. I need to run more tests." Rachel's hands trembled. "I can't do this again, Elijah. I can't go through another year of doctors not knowing." He met her eyes. "You won't. I promise you. We'll find it this time." But deep down, even he wasn't sure. Hey, Nurse Chat. One important thing to know. Patients with Addison's disease often have other autoimmune disorders. Their immune system doesn't just attack the adrenal glands. It can target the thyroid, pancreas, or even the skin. This is known as autoimmune polyglandular syndrome, and it can make diagnosis incredibly difficult. Weeks passed and Rachel grew weaker. Her skin, once glowing, had faded to an ashen gray. She struggled to climb stairs, to hold her children, to keep her eyes open through a full day. At night, Mark listened for her breathing, terrified of waking up to silence. She journaled less now, writing short, fragile sentences. Open quote, "I'm tired. Everything hurts. If this isn't the Addisons, what is it?" Close quote. Dr. Warren reviewed her latest labs late one evening, sitting alone in his office long after dark. He flipped through the pages: elevated CRP, low sodium, abnormal liver enzymes. He leaned back in his chair, whispering to himself, "It's not Addison's anymore. It's something else." But what? The mystery had returned. And this time, Rachel didn't have a year to wait for answers. 3 questions remain as we close this second chapter. 1. What happens when one rare disease awakens another hidden beneath it? 2. Can Dr. Warren uncover what's destroying Rachel before her body gives out again? 3. Or has her fight already reached the point of no return? Part 3 of The Woman Who Faded Away airs tomorrow. Thank you for tuning in to Last Breath Diaries. Remember to like, comment, share, and subscribe. And don't forget to turn on your notification bell so you never miss a single episode.